Experiencing worsening symptoms when you have multiple sclerosis can be scary. When patients have a change in a symptom, they may automatically assume they're heading into a relapse. But these episodes can actually happen for a few different reasons. Physicians use the term relapse for new or worsened symptoms that are due to new inflammatory MS activity in the brain or spinal cord. In a true relapse, the new symptoms usually manifest over a few hours or days, plateau over a few days to weeks, and then slowly improve over weeks to months. The vast majority of the time, this kind of worsening is associated with a change in your MRI. When physicians use the term pseudo-relapse, we are referring to worsened symptoms, but that do not come from new immune system activity, rather from the damage that already exists from previous inflammation. A pseudo-relapse is not associated with an active MS lesion on MRI. This is a very important distinction, because treating pseudo-relapse focuses on determining what could be bringing out old symptoms in the body, rather than rushing to give steroids. Many things can trigger a pseudo-relapse. Increased body temperature from a fever, overexercising, a hot tub, or sauna. Infections, even without a fever. Trauma, surgery, new medications, other medical conditions, like having high blood sugar in a diabetic, for example, as well as psychological stress. A neurologic exam, or MRI, can help to definitively differentiate between a relapse and a pseudo-relapse. But there are some other clues that can help us differentiate between the two. If the worsened symptoms fluctuate, and especially if they go away completely and then come back, that's a good sign that this may be a pseudo-relapse. Is the symptom old or new? The recurrence of old symptoms is more common in a pseudo-relapse. And lastly, localization. In neurology, localization is the term for identifying the actual site of inflammation within the brain or spinal cord. Sometimes neurologists can say for sure that there's no place in the central nervous system where a relapse could be causing all of the current symptoms. This would indicate to us that another process may be going on, which is affecting the MS and causing generalized worsening rather than a new active MS lesion.